Minerals are essential for a wide variety of metabolic and physiologic processes in a pigeon's body. Some of the physiologic roles of minerals important to pigeons are their involvement in muscle contraction, normal heart rhythm, nerve impulse conduction, oxygen transport, oxidative phosphorylation, enzyme activation, immune functions, antioxidant activity, bone health, and acid-base balance of the blood. The two major classes of minerals are the macrominerals and the trace elements. About 99% of the calcium in the pigeon is stored in the skeletal system, while the remaining 1% is present in other cells, such as muscle cells. Although this muscle cell calcium is involved in a variety of physiologic processes associated with energy metabolism and muscle contraction, calcium supplementation is not considered to possess ergogenic potential because, if necessary, the muscle cells may draw on the vast reserves stored in the bone tissue. However, as noted above, young women involved in weight control sports, such as figure skating and distance running, may have inadequate dietary intake of calcium. Additionally, exercise may increase calcium losses. For example, Dressendorfer, 4 and others examined the effects of 10-week intense endurance training, including volume, interval and tapering phases, on serum and urinary minerals levels. They found that urinary calcium increased and serum calcium decreased below the clinical norm following the high-intensity interval phase, but these changes were reversed following the tapering phase. Thus, it appears that calcium excretion may be increased with high-intensity training. Inadequate calcium intake and increased calcium losses may predispose one to osteoporosis. This may be especially so in women who develop the female athlete triad: disordered eating, amenorrhea, osteoporosis. For example, Bremner and others, 5, recently noted that long-distance runners with oligoamenorrhea had greater decreases in bone mineral density in the spine than in the femur, even though they had similar energy, calcium and protein intakes compared to amenorrheic runners. The National Institutes of Health Consensus Panel on Osteoporosis indicated that supplementation with calcium, along with vitamin D, may be necessary in persons not achieving the recommended dietary intake, such as these female athletes. 6. Additionally, athletes with amenorrhea should consult with their physician regarding the need for drug or hormonal therapy to help prevent osteoporosis. This research makes me think that we need to provide our pigeons with more calcium is very important. I like powdered milk and crushed oyster shell. Phosphates for pigeons. What do you think? Phosphates are incorporated into many compounds in the body that are involved in energy metabolism, such as ATP as an energy substrate, thiamin pyrophosphate as a vitamin cofactor, sodium phosphate as a buffer, and 2,3-diphosphoglycerate 2,3-DPG for RBC function. All of these roles could provide ergogenic potential, but the most researched theory involves the effect of phosphate salt supplementation on 2,3-DPG. Increased levels of 2,3-DPG could facilitate release of oxygen from hemoglobin in the red blood cell and possibly enhance aerobic endurance exercise performance. Previous studies have generally, but not universally, shown that phosphate salt supplementation increases serum 2,3-DPG levels. Most recently, Bremner and others found that a 7-day phosphate loading protocol would increase erythrocyte phosphate pools in 2,3-DPG. 7. About a dozen studies have been conducted with phosphate salt supplementation and their effects on physical performance, and the results are clearly equivocal. However, no study has reported decreases in performance, and 4 studies from independent laboratories have shown remarkable similarities relative to increased levels of VO2 max following phosphate supplementation and improved performance on bicycle ergometer exercise tests, such as a simulated 40-kilometer cycle time trial 8 to 11. Although these results are impressive, Tremblay and others, 12, indicated that a number of confounding variables in previous research have been identified and more controlled research has been recommended. Research conducted during the past 10 years has also been equivocal, but some favorable effects have been shown. For example, Goss and others recently reported that although phosphate supplementation did not affect physiological responses during exercise at about 70 to 80% VO2 max, the rating of perceived exertion (RPE) was lower, suggesting a beneficial psychological effect. I only provide my pigeons early in the week with these salts, in very low amounts in form of electrolyte,